Ortho Tuesdays on! Bienvenidos! Back to doing some videos in English. Some of my expats patients have been asking me for that. Today we're going to talk about Olecranon fractures. I'm Dr. Eric Curi. Welcome to Ortho Tuesdays. Today we're talking about a type of fracture that is relatively common involving our elbow. So the olecranon is part of the ulna and it articulates with the humerus. It is the very tip of our elbow that you can easily palpate. Olecranon fractures are relatively common, as I said. They usually happen in elderly women or in young men. The fracture can be by a direct impact to the elbow or in osteoporotic bones due to exaggerated strength, and that would culminate in an avulsion of the olecranon by the triceps. That being said, the triceps is an important muscle in the posterior part of our arm that inserts onto the olecranon. So what happens here is once you have the fracture, due to the force of the triceps, that fragment tends to come apart from where it should stay. And once the fragment is displaced, usually this becomes a surgical fracture. The olecranon fracture also many times is an articular fracture. The way the bone breaks walks into our elbow articulation. And articular fractures, we cannot tolerate significant displacements, because this would lead to a callus formation, and a callus within the articulation would compromise the proper bending of that articulation, and this would evolve with arthritis. Once diagnosed with an olecranon fracture, the patient will be immobilized with a cast and a sling. Then we'll decide if the fracture will be treated surgically or non-surgically. Surgery options include Kirschner wires and plate and screw techniques. Olecranon fractures are a common diagnosis that has a good prognosis. The main complication is the loss of a small amount of our elbow range of motion. If you or any of your friends suffer with elbow or shoulder issues, or you just need an orthopedic here in São Paulo, I'd be glad to help. I'm Dr. Eric Curi. If you can subscribe, I'd be very thankful to that. And I'll see you on the next Ortho Tuesday.